This is 17 News with continuing coronavirus coverage.
Good afternoon, and thanks for joining us. I'm Nicole Gitsky. Governor Gavin Newsom is streaming live every day at noon to provide an update on the coronavirus crisis here in our state. Now, today he's talking about the state's response to the COVID-19 pandemic. We will bring him to you as soon as he becomes available. Now, in the meantime, the latest on the coronavirus here in Kern County. Public Health just released new numbers. There are 30 confirmed cases and 2 new deaths, making that total 17. Public Health says we're averaging about 30 new cases a day. That brings our total over 1,300. 806 people have recovered from the virus. More than 10,000 tests have come back negative, and more than 2,200 tests are still pending. Our hospitalization rate continues to rise, especially those in ICU. Right now, there are 37 people in the hospital recovering. And the county is requesting more help to manage the outbreak at Kingston Healthcare, a nursing home in Bakersfield where COVID cases have exploded in recent days. Now, at last check, more than 100 people at the facility have been infected. That's 46 healthcare workers and 62 residents. Now, 9 people have died. The state medical assistance team has sent 39 healthcare workers to help fill the staffing shortage at Kingston. Public Health Director Matt Constantine says he is asking those workers to stay an extra week. And we've been following this outbreak closely and have taken a closer look into Kingston's records. The facility's history dotted with lawsuits, citations, and accusations of poor care. Now, you can get caught up on KGET.com. Just click on that hot link icon. And county officials say the deadly outbreak at Kingston Healthcare has slanted the county's coronavirus numbers and is slowing the county's efforts to reopen. Now, last week, Governor Newsom released guidelines for phase 2 of reopening. Kern County meets all the governor's criteria except 2. First, no COVID-related deaths in the past 14 days. Kern has had 12 deaths. Second, no more than 1 case per 10,000 people in the past 14 days. For Kern's population of 900,000, that would mean no more than 90 new cases in the last 2 weeks. We've had 498. But according to the county, many of Kern's cases and deaths come from Kingston's healthcare. 8% of the county's cases, 60% of the deaths, and nearly half the hospitalizations. Now, the county is asking the governor to not let the one nursing home affect the entire county's ability to advance through phase 2. Now, that county also hopes to prevent another Kingston from happening.
We've actually been talking to the state since last week about testing all of the skilled nursing facility employees and all of the residents. We've even offered county resources to the state to get this done.
A man is arrested accused in a deadly stabbing. Kern County Sheriff's deputies arrested Rafael Salas on Sunday night. They say he stabbed a man near the corner of Water Street in North Kern. That man showed up at Memorial Hospital with major injuries. He was moved to Kern Medical where he died. Now, his name has not yet been released. And a man is under arrest accused of crashing into a motel, then tossing a gun as he ran from police. Officers were called to the Motel 6 at California Avenue and Easton Drive just before 9 o'clock last night to find a car had crashed into the building. Police say the driver took off running. Officers gave chase and the driver allegedly tossed a firearm as he tried to get away. The man was caught and taken into custody without incident. He did not appear to be injured. Now, it's unclear what caused him to run. And not one but 2 crashes temporarily shut down Highway 178 near Lake Isabella. The first happened yesterday afternoon around 3 at 178 and Yankee Canyon Drive. 1 person died in that crash. The second involved a vehicle that went off the roadway and sparked a fire. That second crash happened in the same area around 4:30 yesterday. Flames from the car spread to nearby grass. Now, at last check, the Kern County's fire department says 12 acres have burned and the fire is 50% contained. We're told crews stayed out there all night to put out those hot spots. And we have a quick correction to make on a story we ran last night about a suspected DUI crash. That crash happened early Sunday morning near the intersection of White Lane and Stein Road. BPD says the driver of the red car was arrested for a misdemeanor DUI and driving with a suspended license from a previous DUI. In our story last night, we misstated the seriousness of the incident, and we want you to know no one was hurt. And starting today, new fire restrictions for the Los Padres National Forest. The restrictions will affect the use of campfires, stoves, smoking materials, and internal combustion engines and will remain in effect until the end of fire season in late autumn. Those restrictions include no open fires will be permitted outside of recreation sites, new smoking protocol, along with no fireworks within the forest. And happening now, the Senate Health Committee is holding a hearing on the COVID-19 pandemic. Senators are hearing an update on what federal, state, and local governments are doing to help Americans go back to work and back to schools as rapidly and safely as possible. Dr. Anthony Fauci, the director of National Institute of Allergy and Infectious Diseases, is talking about the dangers states could face if they open without following recommended guidelines. During the hearing, Fauci said it was unrealistic to expect there to be a vaccine developed in time for a hoped-for return of students to campuses in the fall, even though, according to him, there are at least 8 coronavirus vaccine candidates in development.
Good afternoon, everyone. I'm Kevin Schredt. Let's talk about our forecast, and we are looking at a beautiful, beautiful sky here. We did see mostly cloudy skies earlier, but then those skies have started to part ways, and we're starting to warm up here a little bit. Right now, we've got 72 in Bakersfield, a northwest wind at 7 miles per hour, and overnight we were at 57, so right where we should be this time of year. Normally, 83 is our high, and we will be below that today with the 70s, and I don't think anybody will be complaining about that. 60s and 70s all around right now, with 50s and 60s up in the mountains, and we've got 66 out in Mojave. The clouds have already started to part ways. We've got a little bit of cloud cover still in the mountains. In fact, Natalie Jansen sent me a picture earlier where there was actually a little bit of light rain up that way. It's all due to a front that's pushing through the state right now. Limited moisture, but it's caused some stronger winds in the mountains and also the cooler air, which we're all going to enjoy today. We're looking at 58 in Sacramento, 76 in Fresno, lower 70s down to the south in LA and San Diego. Once this front pushes on out, we will start to warm up a little bit as a ridge of high pressure builds in for the weekend. And then another front will push on in next week, and that will cool us down once again. As we take a look at the Futurecast model, you can see here that the next system coming in next week will be limited in moisture for us as well. We will keep that more to the north, but it will usher in some cooler air once again, so that'll be a good thing. As we take a look at the air quality for you today, we are looking good with an AQI at 46, and your forecast today calling for 77 in Bakersfield, 78 in Delano, 74 in Taft, and then for the mountains in the Kern River Valley, we're looking at 63 in Frazier Park, 61 in Tehachapi, and right near 70 into the Kern River Valley. And taking a look at the desert, also a very nice day, 71 in Mojave. Here's a look at the extended forecast, a little warmer for the weekend, back down again next week. And for the mountains, also, we'll look at breezy conditions through Friday, and then you can see next week by Monday, cooler again. And for the Kern River Valley, very nice weather as we go throughout the next couple of days. We've got much more news coming your way right after the break.
There will be no public ceremonies for National Police Week, but local departments are still honoring the people who lost their lives in the line of duty. The Kern County Sheriff's Office held a service at the Peace Officers Memorial on Norris Road. The video shows deputies and volunteers who have died in the department's long history. The monument is open for the public to pay their respects. And the Bakersfield Police Department plans to live stream its memorial service on Thursday. They also will not have a public event due to COVID-19. Now you can watch it. It starts live at 6 a.m. on all of BPD's social media pages. Well, this week is important as we honor those who took the ultimate sacrifice and lost their lives in the line of duty. Sergeant Nathan McCauley, the Public Information Officer for Bakersfield Police Department, explains more about Police Memorial Week and openings for the police trainee position for the Academy.
As a police officer, it's very important to remember those that came before you and those that gave their lives for serving their community here. So regardless of the circumstances, we can't have some of the events that we would like to have, but it's still very important to all of us to make sure that we still remember those and we still continue to remember who they were and what they did for our community. And so we'll still have events. We'll still have things that's just going to look different. We'll have a lot more things that are virtual based and video based, but still make sure that we were able to recognize them during this week.
Again, we talk about what everyone's doing. Things are looking a little different right now. People are working from home. A lot of our essential workers, of course, out and about serving our community, including first responders, including police officers. Can you just tell us a little bit about what our local officers are doing right now during the middle of this pandemic?
Well, for the most part, a lot of our work is business as usual. They're still going to come to calls. They still want to make sure that they're there when you need us. There is some additional protective equipment. They're making sure that they take precautions, keeping things as clean as possible, making sure that they're wearing appropriate protective equipment. They have a few extra measures that wouldn't have been in place before, but they want to make sure that they can still go to these. They just want to make sure that they can do it safely when they go around there. So there has been changes. There's been changes in kind of the way some of the shifts are run, some of the protective equipment, some of the cleaning supplies for that. The ways in which they'll respond to certain calls, making sure that people are wearing masks, things like that, which would definitely not be something you would commonly see before this. But it's still making sure that we can still continue to serve the community while doing so and keeping our officers and our staff safe.
Kern County, of course, shows their respect when it comes to our local law enforcement officers. What do you want our community to know about the men and women who are serving this community, putting their lives on the line every single day?
Well, I want them to know that we're still here, and these people work very hard, and they're definitely working to do everything they can to keep our community safe, to make sure that they're still going out to all the calls for service as they would have before. We have a very dedicated group of people. They're very passionate about what they do, and not just our sworn staff, top to bottom throughout our department. We have a fantastic place to work as far as just everything that you do. That you have a very dedicated group of individuals that really take care of one another and really strive to do their best job they can. And that's kind of what we'd like to do is in addition to Police Week, we're also trying to make sure that we prepare for the future of the police department and try to get people to come out and apply for our positions. We're a growing department, and we have some openings now, and they just started running that application on May 8th, and it'll continue to run through June 5th. So there's an opportunity to see what it's like to be a police officer and become part of this department. It's a lot of exciting opportunities coming up over the next several years.
Now, we do have Governor Gavin Newsom ready to speak. Let's take it over to him and hear what he has to say today.
Modifications that we look forward to making to our stay-at-home order, again, is our ability to test. I say again because we talk about testing on a consistent basis. And consistently, we have been underperforming as a nation and as a state to provide adequate testing for all that seek it and all that need it. The state of California, we recognized that early on that we needed to do more and do better. As a consequence, we pushed the reset button, we put together a new team, and we approached the challenge quite differently. It was just a month or so ago where we were averaging just 2,000 tests a day. In a state as large as ours, that was completely unacceptable. We put together some very specific and prescriptive guidelines and expectations, put out our stated goals in terms of what we wanted to do to achieve substantially more testing throughout the state of California. And I wanted today to give you a report card on that. We have now surpassed 1 million tests conducted in the state of California, 1,033,000. Just in the last 24 hours, we were able to conduct over 41,000 tests, not dissimilar to the last few days, testing north of 40,000 people each and every day. You just look back over the last 7 days, averaged north of 35,000 tests, on our way to do justice to our commitment, and that is to get to 152 tests per 100,000 population, which is tests north of 61,000 each and every day. We're confident we can achieve that goal. It is phase one goal. We want to do even more and do better than that. But in an effort to keep you abreast, you may recall that our goal was to hit 25,000 by the end of the month. We're now in this first week doing 25,000 plus 10,000, meaning 35,000 on a daily basis on average. So making progress. The second commitment we made to you is that's nice, but what about me? And what I mean by that is, what about you? living in a rural part of California? What about someone that's seeking the test that doesn't want to be charged, that can't afford to be tested and can't find a testing location in their community? We made a subsequent commitment that it's not just the total number of tests, it's where those tests are proximate to people in urban centers within 30 minutes, 30 miles, or within 60 miles in rural communities. We made a commitment, partnership with OptumServe to focus 80 sites in rural California, and with Verily to provide 6 sites that would be provided in a more culturally competent way, focusing on the needs of the Black and brown community in the state of California. We've made great progress in that respect. 76 of those 80 Optum sites are fully operational. The only concern of the remaining 4 has been some site negotiation that has extended a little bit longer, but substantial development in terms of those 76 sites. The 4 remaining sites we're working through in real time, but the announcement I wanted to make today is an additional 6 sites will be put up by OptumServe to go even deeper into rural California. For the folks in Lake County, as an example, Mendocino County, you deserve those points of access, and we are committing to getting those testing sites up and operational with this new commitment from OptumServe very shortly. Other parts of the state, even more remote rural regions of this state, we're looking not to do point fixed sites, or rather sites that have point of tests that are fixed to a particular location, but to start to do these roaming tests that can expand our capacity even further. I'll remind everybody, if they would like, to go to the covid19.ca.gov website, covid19.ca.gov website. Click in the testing button, and you can put in your zip code, and you can determine the closest available testing site. We have 241 community sites that we are tracking that are available for testing, plus the Verily sites, plus those OptumServe sites. You'll see there's still testing deserts in this state, and that's, again, the announcement we're making today to do even more with OptumServe, and then we'll start these roaming testing sites very, very shortly to provide even more coverage. I also want to remind people, it was an outstanding question that was asked yesterday, a simple question. What about costs? Just so you know, the site that we are providing, the COVID-19 site, those test sites are free. Regardless of your status, community clinics are providing testing for free. These other community sites are providing testing for free, OptumServe and Verily. There are pop-up sites all throughout the state of California. Some of them may charge your insurance, may charge you out of pocket. Before you're charged out of pocket, I would just encourage you, or tell a friend, encourage them to go to the COVID-19 site to take a look at the availability of the sites that we have up so you can avoid coming out of pocket. We're trying to do our best to soften that edge and make sure people know that cost shouldn't be an impediment to getting these tests. But look, a long way of saying million is an important milestone in our efforts. It's still not where we need to go. We need to get, again, north of 60 to 80,000 tests every day. Some would argue well north of that, and I'm not going to even debate that. We're going to go as far as we possibly can. I mentioned just a few weeks ago that if all of our system, our testing capacity, was at 100% testing capacity, we can be just shy of about 100,000 tests a day right now. So there's still some supply chain constraints. There's still some issues with swabs and the transport media, issues related to reagents for PCR tests. This is not the universe of antibody tests, these serum tests. That's a separate discussion. That's a separate frame, and we can talk more about that. These are the PCR tests primarily that we're speaking to that we are confident will provide the kind of quality and assurance in terms of reliability that is, FDA approved, and to the extent we can monitor the efficacy we do, is as efficient and as effective as we think is out there. Many other tests, though, are popping up that don't necessarily have that gold seal, and so always points of caution at these point-of-care pop-ups that you may run into. But go to our site first. We'd encourage that, again, covid19.ca.gov, and we'll continue to update that. These new OptumServe sites come up. We'll put them out quickly, and these roaming sites, we'll let those, we'll provide information about where those will go to cover multiple counties and help us, again, through our next phase of reopening here in the state of California. In order to also advance our testing capacity, we put out an executive order a little bit ago that directed a couple of departments, Department of Consumer Affairs and our board of pharmacies, folks that oversee our pharmacy industry in the state of California. I say industry just because we have some 6,492 different pharmacies in the state of California that are licensed, almost 6,500, and thousands more pharmacists that they're responsible for overseeing. That board, with the Department of Consumer Affairs, just today finished up their work and have provided guidelines to expand the points of contact for testing into pharmacies throughout the state of California. Now, let me make this crystal clear. They now have pharmacies the ability to do tests. That doesn't mean every one of them is going to start testing today or even determine that it's in their interest to test at all. It's a determination on the basis of each of these pharmacies whether or not they want to do this. Now, know that pharmacists, many of you do know this, test for hepatitis C in many cases, for HIV. There are protocols and procedures, appropriate protective gear, making sure that we isolate folks that may be symptomatic, maybe asymptomatic, but are concerned. We obviously have to work through all of those. That will be done on each site and will be done in collaboration and the oversight and guidelines that these two agencies have put forward. But the good news is we are now going to increase additional sites with our pharmacies in the state of California, and we hope to start seeing those pop up very, very soon. So that's also, we think, an important milestone in an effort to broaden coverage for testing in the state of California. All of this, again.
All right, we just heard the latest from Governor Gavin Newsom. Now, today, he just mentioned that there will be 6 additional OptumServe sites for testing. That way they can increase their testing. As well as today, they are going to be expanding testing in pharmacies. Now, that means pharmacies will have the ability to test as of today. And he's saying also that as of today as well, we are seeing about 40,000 tests every day. Now, compared to when this first happened, it was only 2,000 a day. Their goal is to be at 60,000 a day in testing as well. Now, you can continue listening to whatever Governor Gavin Newsom has to say about testing and more going on in California on our website, KGET.com.
This is 17 News with continuing coronavirus coverage.